Stephen Reicher, your students are returning to the campus that's in Andrews this week. It's this week that triggered a fresh wave last year. What are you doing on campus to make sure we don't have a repetition?
Well, there are multiple measures that are going on in all universities. Across Scotland, for instance, there's very clear advice on the need to keep people safe, on the need to have testing, need to have vaccination, very clear messaging on the need to behave responsibly so you don't put others at harm. So I think, at least in Scotland, and I can speak for Scotland because I sit on the recovery group for universities in Scotland, every university has a very comprehensive plan about the return over the next few weeks, although actually in Scotland, most people have already got back. When you talk about what's happening, often it's very Anglo-centric and you forget Scotland.
I could never forget Scotland, Professor Reicher, but I just wanted to be absolutely sure that you feel confident that we're not going to have the same problems that we've had in the past. You feel confident about that at the moment?
Oh, I mean, there's huge uncertainty. I mean, simply put, we don't know what's going to happen, and that's true not just in universities, but more generally. As as schools have returning, they returned a while back in Scotland, and we've seen a spike in infections in young people. Now the data is beginning to come through in England. People returning to university, people returning to the workplace, people returning indoors because of I'm getting awkward because of the weather. All these are factors, and we can't know absolutely, but we have to be careful.
Well, we discussed all of those questions actually with the Scottish First Minister last Sunday, and it's clear that there's a slightly different point of view. You yourself have been pretty critical of the government, of the Johnson administration, for not underpinning its legal measures with behavioural science and behavioural nudges. Are you supportive of what they've done this week on travel restrictions?
I think the example of travel restrictions is an example where we had a dysfunctional system. Dysfunctional because of all the mess around getting PCR tests, all the different companies charging absurd rates, not providing a service, and so on. And they've responded not by improving the system, but by abandoning it entirely. And I think that's a pity. I do think we need PCR tests because everybody always said that lateral flow tests were never what were called green light tests to say you're safe and therefore we can you can act as if you don't have the virus. What they do is they pick up asymptomatic cases and are very, very valuable in that regard. I think it would have been far preferable to keep PCR tests, but to improve the system and to do them through the NHS. So I think it is increasing risk. I think it does limit. In fact, it stops our ability to trace different variants and increases the probability of infected people coming into the country. So I think it has increased the risk, quite frankly, and I think we should have improved the system rather than, by and large, abandoning it.
OK, so you're against the dropping of the PCR test. Do you think that the decision to offer booster jabs to everyone is actually a good step forward?
Well, rather than doing this piecemeal, let me give you my sense of the overall direction of travel we should have. Because if you remember back to last year, 21st of September last year, SAGE made a recommendation that we need to put protections in place in order to avoid the pandemic getting out of control. And the government ignored that. They ignored it for nearly 2 months. The pandemic got so far out of control that, as always happens if you wait and things get out of control, you have to impose greater restrictions, which is why we had a non-Christmas and such an awful winter and spring. On the 8th of September this year, SAGE again made the point that actually we're in real danger. We can't be certain, but we're in danger of things running out of control. And rather than having to put in place severe restrictions later, let's do sensible things now. And the good place we're in, largely due to the vaccine, is that in order to get things under control, if you combine the vaccine, not with stringent lockdown, but with moderate protections and support for people, then you can bring even the Delta variant under control. And that's been shown in a range of countries. It's been shown in Israel, it's been shown in Denmark, it's been shown in Singapore. So what I would do is not restrict the public, not lock down the public, but increase the protections for the public. And let's take just one very simple example. When we talk about safety, we often
If
focus
you
on the individual. The individual must get vaccinated. It would be far more effective, I think, to make sure that environments are safe, that the pubs and the clubs and so on that we go into have got proper COVID standards. So why don't we have a proper licensing
okay,
system, exactly the same way that we license kitchens to make sure that they
okay.
don't infect us, to keep us
Uh,
safe. So protections, not restrictions, protections and support along with the vaccine, that will keep us safe.
Very briefly, there are nearly 6 million people who, either because they couldn't be bothered or because they are actively opposed to it, have not been vaccinated. Very briefly, is there any way that you can see to get those people jabbed?
Yes. First of all, as you say, most people who are not vaccinated aren't vaccine hesitant or anti-vax. They simply haven't got round to it. So make it easier for them by bringing vaccine stations into schools, into universities, into workplaces. Make sure that people can have paid time off to get vaccinated. So make it easy. Bring the vaccine to the people. That's number one. Number two is to give clear and consistent information as to why vaccines are important. And if you spread
Okay.
a message implicitly or explicitly that infections don't matter, then people are going to think, why should I get vaccinated? And the third and the most
Okay.
important is, amongst those who have doubts, don't treat them as fools, don't treat them as the enemy, don't push them away, don't push them into the hands of the anti-vaxxers. Build trust, show respect, listen to people, address their concerns, and as I say, win them over. Trust here
Okay.
is absolutely critical, and that's one of the
Okay.
things our government has forgotten. Build trust.
Uh,
Don't distrust the public.